benefit segment for USI out of the Cincinnati office, and Bill Mills from Best Upon Request, and Jake Bast from St. Elizabeth Physicians. Before we jump in, I've shared some about USI, but I'll ask Bill to share a bit about your organization and your background, to introduce yourself, and then pass it to Jake to do the same for St. Elizabeth and himself. So, Bill.
Thank you, Josh. Good afternoon, everyone. My name is Bill Mills. I'm the president and COO of Best Upon Request. We're a national concierge service provider. And specific to today's conversation, we are an employee benefit, an employer-paid employee benefit. And so we serve employees of companies. We serve physicians in physician groups, which is part of the conversation today, but we serve in healthcare. We also serve in the corporate setting. So we have a broad coverage. We are a national company, and we are providing amazing experiences for employees of companies. And when I say amazing experiences, it's not just about an amazing experience, but it's about providing care. And in healthcare in particular, caring for the caregivers is a key component of what we do. And so we'll get into that later, but it's a pleasure to be here. It's a pleasure to have the opportunity to speak alongside Jake, who is one of our clients. And again, more out of that in just a few minutes. You mentioned a word about our background. My background, the first half of my career was in automotive manufacturing for a Japanese company. And I have found that background and those experiences have really fueled insights and continuous improvement for me as I have progressed. And I've now been with Best Upon Request for 10 years, and I'm very proud to be here because we're doing some amazing work. For me, every day is like mission work. We're serving people and we're making life better for people who are working really, really hard. So excited to have the opportunity to talk about that.
Thanks, Bill. Thanks, Josh. Welcome, everyone. It's great to be here with you. My name is Jacob Bast. I'm the Chief Operating Officer for St. Elizabeth Physicians, which is the integrated medical group with St. Elizabeth Healthcare. For those participants that aren't in the local region, we're in the Cincinnati tri-state area of Ohio, Southeast Indiana, and Northern Kentucky. The predominance of our services are in Northern Kentucky, although our medical group has a number of practices in Southeast Indiana, and of late, our hospital operation also has one of our 5 acute care hospitals in Southeast Indiana in Lawrenceburg. We've grown in our 12 years as an organization from about 100 providers to over 700 today. And we'll talk more about how that growth has developed in a little bit because it's a key part of our story, but very excited to share that with you today and looking forward to interacting. As far as myself personally, I've been here in Northern Kentucky with St. E's for just shy of 10 years. My career after finishing my master's in healthcare administration at the University of Minnesota Twin Cities took me to Wisconsin and then to Southwest Missouri and now to here. So, and this is a great community. It's a great region for those that live in this area. You know that, and looking forward to many more years of serving it. So thanks, Josh.
Great. Thank you both for the introduction. With that, I'll stop sharing and make our faces bigger, for better or worse. We start the conversation, and Jake, I'll actually go back to you with the kickoff question. Much has been said about burnout with healthcare workers even before the pandemic started. So 2 years ago, there were headlines about burnout in the healthcare workforce. Can you kind of give us perspective on what is the state of the well-being in the healthcare workforce as it stands right now, and maybe how has it changed since 2 years ago, and where are we at now?
Yeah, and I think just as much as I can, anyone who's participating in this could speak to this really well because it is so much different today than it was even before. But our awareness of it dates back several years, and many of us have adopted a concern about well-being and burnout at different points in the last several years. But for me personally and for our organization, I really became aware of it after attending a conference where Tate Shenefeld, which for those of you that are really ingrained in this this part of our important topics is one of the industry leaders. He grew up in his career at Mayo. He's now leading the wellness program at Stanford, and I saw him present, in which he illustrated really the two main channels that impact burnout among healthcare workers. And there's the resiliency side, which many of us often think about is, let's just do a little yoga, or let's just start a book club and everyone will be better. But in reality, so much of what's impacting the wellness of our associates and providers in healthcare is systemic. It's the processes we put in place, it's the systems we put in place, and not the least of which are electronic health records, which many of us are quite familiar with, and the adoption of that. So it was following that we really decided to place an emphasis on it. And I'll try not to be too long-winded, but thinking back to our 2017 medical group board retreat, and we decided purposely to take a different angle at that board retreat. Rather than traditional strategic planning, we wanted it to be about culture. And we posed to our board and other participants the question, what do we want to be known for as an organization? And it was really interesting and humbling that in the first couple hours of that board retreat, we did an exercise where we asked the question, what are we known for today? And among a lot of different answers, what it really came down to is we're known for the fact that we work really hard. And that was worn in some regards as a badge of honor, but I think the realization is there are some consequences that come with that. And so we came out of that retreat with, among other things, a mantra that we created in several related initiatives. And that mantra was caring for our patients, caring for each other, that those two have to go hand in hand in order to create a culture of organizational success where we'll actually be able to care for those patients. And various initiatives came out of that, including many things that your organizations are familiar with, a compact of mutual expectations. What are those behaviors that are expected of all of us, including our physicians and APPs that work at St. Elizabeth Physicians? A provider professional review process, a number of other things, but probably the most glowing and the one most pertinent to today's conversation was a comprehensive wellness program that in and of itself has, a couple of handfuls of different initiatives. But it was a part of that path that we took that led us to who happens to be a neighbor. They are a national organization right across the river in Cincinnati, but the opportunity to connect with a professional concierge service as one of the multiple facets of our wellness program for our physicians and APPs has really proven beneficial, and it became somewhat the cornerstone or the foundation of us building that program.
So it was out of that strategic process that you engaged Best Upon Request. Is that right?
It really was, and it just, Best is among a component of a lot of components in the layers of our wellness program. But that culture board retreat was so important to us at that time in our development, because like many on this conversation that work with physician groups or in integrated health systems, so much of our initial growth as an organization was through the coming together or acquisition of many private practices. And I counted them up one day, over the years, we've brought together 32 different individual organizational cultures. And those don't go away the day that you give them a new badge. And so there's a lot of that legacy that we don't want to lose, but also the development of our own identity and culture as an organization. And wellness has become a big part of that.
I think you said it earlier. How many physicians and APPs are employed by St. Elizabeth?
We have a total of a little over 700 in our medical group. That breaks down to about 450 physicians, and the difference in a combination of nurse practitioners, PAs, midwives, behavioral health therapists, psychologists, of the like.
So you mentioned best upon request being one leg of the stool, so to speak. We have Bill here, so I know we're going to get deeper into his solution and the work they do with St. Elizabeth's. Can you talk about some of the other aspects and tools that you brought to the table for your organization
Sure,
outside
and
of
I'm
best upon
probably
request?
not going to do it good service. It's one of the few slides that I've got in the background here that I didn't think to bring up. So I'll do this off the top of my head and forgive me. But some of it are the resiliency sort of things. We have, or certainly before COVID prevented more in-person opportunities, we would purposely host golf outings, family movie nights. We did have book clubs, even though I used that somewhat tongue in cheek earlier, and they were very, very well received. We had wine and painting nights where folks would come together and they'd meet at an art studio and do some paint or sculpture. Those social outlets uh, that harken back to the days of truly private practice environments where the cultures were built around those personal connections that physicians had with each other. And it became a part of the identity of their group. And frankly, is sometimes somewhat lost when you move more into a large integrated group type of environment. But we also focused very heavily on those systemic issues and without going into too much detail about a number of them, the most obvious one is the use of our electronic health record, which we're on the Epic platform. Many of us on this call probably are. And realized that some of the predominant concerns being raised by physicians and APPs in the use of Epic was what we've come up with the term pajama time, the amount of hours spent at night and sometimes wee hours of the morning catching up on their documentation because the level of efficiency and use of Epic didn't afford them the opportunity to do that during normal hours. And we've actually become quite proactive with some analytics tools that we have in identifying those providers that are spending a lot of pajama time or time on their days off or are less efficient in the use of Epic and targeting interventions and opportunities to work with them and have our trainers work with them to help them be more comfortable in the use of that tool. So Josh, those are just a couple of examples of what our wellness program is doing, but it even goes further into a more elaborate and comprehensive onboarding program to make sure our physicians and providers are well versed in what they got themselves into when they come to join St. Elizabeth Physicians, and having a good working knowledge of how to access all the resources that are here. So countless different options, but hopefully that gives you a little flavor of what we're doing.
Absolutely, that's great. And there's one word that came up quite frequently there was time. So people can be compensated in different ways, and their effort can be shown in different ways. Many would say that the employed physicians are compensated fairly monetarily, but the time that they're giving up outside of what we normally considered practice hours or office hours, that's a huge mark against the compensation model, so to speak. So, Bill, I think that leads into best upon request nicely, actually. And I think maybe I have your slides here. I can put them up on the screen, just kind of lay the groundwork on what best upon request brings to an organization, the partners you work with. Do you think that makes sense at this point to
Sure.
describe
Yeah.
that? Then you can...
Yeah. And while you're pulling those up, I will say that we often refer to ourselves as the gift of time. And so it is a perfect segue. When I think about what our service does and how it impacts people, there are several metrics that we could consider, but the impact of time is always number one. So while you've got the slides up, I'll jump over to that for a second. And the purpose of this, I shared with Josh earlier, this isn't a sales presentation. This is to give you an idea of what St. Elizabeth is experiencing in partnership with Best Upon Request. And so we try to bring innovation to our conversation, and we try to be very creative in how we partner, really understanding the solution that our clients are looking for relative to healthcare, whether it's hospital employees or physician group employees, in particular, the physicians and APPs. we want to understand what is your challenge, and Jake has touched on some of those. Burnout obviously is a buzzword that's been hanging around pretty effectively for several years now. Jake used the term wellness. We want to understand what our clients are focusing on, and then how we can dovetail into their strategy, and how we can partner with them to have the greatest impact. Just at a high level, again, we provide employee care services, and a couple of carve outs within that. We do have a working mothers or maternity concierge program. Physicians is something that's very near and dear to our heart, because we can all relate to our experience in healthcare. And so we're serving physician groups uniquely, but we're also serving hospital employees as well. On the patient side, we do work with some of our healthcare clients to provide services to patients and their families, and you see those there. Josh, if you want to go ahead and advance to the next slide. This is just kind of a 30,000-foot view of what we do. It doesn't do justice when you think about having someone do some shopping for you, or have your automobile taken care of, or having a courier at your fingertips, or a phone call or a text message away. Taking care of your shipping and your purchases and your drop-offs and gifts and anniversaries, birthdays. The list go on and on. To the right of the slide, you can see some of the impact that the service can have on average. That's our number for our entire footprint. I've got some physician specific and some healthcare specific data I can share with you in a minute, but I want to just zero in on that one need anything else, just ask icon. And so we pride ourselves on being problem solvers. And so when an individual, whether it's a physician, a nurse, whoever, calls us and says, hey, I've got this challenge, we want to understand and solve for that specific challenge. For us, it's not about a list, a menu, a bunch of icons. It's really about, what does your life need? What solution would give you back time in your life? What solution would take you to a new level in terms of performance in your role or as a parent? And that's what we want to figure out and solve for you. And because our concierges are taskmasters, they're problem solvers, they're extremely resourceful, they're able to hear from one of Jake's physicians a challenge, like, I have an elderly set of parents that I'm trying to take care of and reposition. I need to move them. I need to find a facility that's perfect for them. We do all that work for you. You may have, we've had physicians who, physician recently told me, I have a child in California and she's moving, and I was struggling to figure out how I can still be a father to her and support her in the way that I want to. With the concierge service, you found me the mover, you found her the place to move to, you coordinated everything, and Dad got the credit for it. So anything is possible with our service. It really depends on individual needs when they, call and ask for help. And then, Josh, if you want to go to the last slide. And so all those icons, again, they don't mean a lot unless you understand what's going on inside of one of those. So when we say we do home services, we mean everything. Sometimes it's something you're planning for: new windows, new roof, new carpet, new window treatments, something on the inside. And sometimes it just happens. And guess what? Physicians, nurses, they have plumbing problems and have to make decisions. Do I go to work today? I'm on the schedule, but I've got a problem at home. And so having a concierge service gives them the opportunity to even deal with the unplanned and not have to cancel appointments or call in late or just miss work altogether. So we're partnering with the individuals within an organization to use our service to the fullest extent. And again, our concierges have an amazing ability to juggle multiple tasks, be extremely resourceful, and make things happen when people need it. So I'll pause there, Josh. That's kind of an overview of what we do for the sake of understanding what Jake's physicians are using our service for.
Well, I think that's a great overview. And Jake, I'd love to hear reviews or feedback that you've heard from the physicians in your group, if you have any anecdotes there. But before I go to that, Bill, I see this and I'm like, wow, this is a great perk for the highest income people who are very important to our organization. Obviously, productive physicians means strong revenue results for the health systems or the physician group if independent. So it makes sense in many cases to make sure they're freed up to do their job, do what they need to do, their highest and best use. At the same time, we're looking at organizations with 6,000, 10,000 employees. Not all of them are sort of considered VIPs within the organization because of their medical degree and licensure status. Do you work with other organizations that are non-clinical, maybe a more general population? Maybe give us a flavor for it. Does this only work for that small subset of high-paid people?
Yeah, it's a great question and a fair question. The answer is yes. We work with 10,000 employee companies. We work with 20,000 employee companies. We work with 50 employee companies. And so we cover the gamut in terms of how we serve different sizes and different dynamics within organizations. It just so happens, to your point, that yes, physicians in large part are driving the patient experience. They're driving the production, they're driving revenue for the hospital, and they're driving the well-being of the community. And so they're a significant part of the engine. Because of that, I believe physicians become what we call power users. And so when we work with physician groups, the ratio of concierges to physicians is much more focused or much more narrow than the ratio for serving a 10,000 member organization. And so we sort of scope the program to match the needs and expectations of how the client and its employees will use the service. And so definitely physicians use it. And I'll give you some examples later of how physicians have used our service very productively and effectively. But for larger organizations, we will scope and scale the service in a way that it makes sense. Just a couple of numbers. You're talking about physicians versus all of healthcare workers. Physicians use our service, and I think this probably has to do with the population and the demographics of the physician population, but among physician customers in our universe, 60% are female, 40% are male. That number changes when we move into a hospital system. It actually increases. Females go from 60% to 80%. And our data tells us that it's because nurses find such great value in the service. And so when you add in all hospital employees, nurses are the number one user. Physicians would be number two, number three if we're serving a whole system. But it's 80% female because they're working 2 shifts a day. Let's face it. They're doing the primary parental role and they're doing the work role. And so they find this service. And that's the cool thing about it. People who need support, people who need more time, they are the ones who find the service and use it extensively.
Great. Well, thank you for sharing that. Jake, again, back to you. What's been the feedback from the physicians, St. Elizabeth's employees? How do you use this in your own recruitment efforts with the new physicians?
Yeah, so easy answer is it is adored. We have, Bill has shared with me, a relatively strong registration rate, so folks can register to be a part of this service, and then a rather high percentage of those registered are routinely using the service, and the feedback is always glowing. And it really does come down to time. From an organizational perspective, we truly put this in place as with the intention of providing time convenient service to our providers. It didn't really take into consideration what has turned out to be a very important organizational metric, and Bill alluded to it earlier, is far fewer provider canceled appointments or schedule changes as a result of being able to take advantage of this service. And Bill gave a couple examples earlier, but it's everything from buying groceries and having them delivered to the home to, Bill, I hope you don't mind me saying this, helping plan my sister's backyard wedding, which fell into that category of, give us a challenge and we'll figure it out. Probably not one that they want to routinely advertise doing, because I'm sure it was very resource hungry, but it's a testament to the type of company and the type of people that Bill hires at Best Upon Request. And those are the things that are difficult for us in leadership roles within the medical group to be able to directly help and impact. We're not the experts in that. We don't have the resources to make those things happen, and yet it has such an impact on the lives of our physicians and providers. And it's interesting you asked about what about the non-provider associates? And I think we would love to be able to provide that benefit to them. Sometimes it comes down to resource prioritization. We've all been put in those positions from time to time, but it's interesting how we have found how frequently the physicians are using the concierge resources to bring in lunch for their staff, or to provide some gifts, or to do this or to do that, the little niceties that the concierge makes it easier for the physicians to be able to do that. And remember, in a medical group, we're not on a huge campus where there's a couple thousand people at the big hospital, all within, walking distance of each other. We have about 75 different physical locations and over 100 different practices in those locations, ranging anywhere from 10 people in an office to 50 or 100. And so these concierges are constantly working out of their cars, moving from place to place to meet a variety of different requests and needs. And often the benefactors are our staff, even though that benefit is not being directly provided to them.
Yeah.
Bill, I know you spend it.
I'm sorry. It made me think when Jake was talking, we had the opportunity about a year and a half ago to conduct some one-to-one interviews. And so a couple of us interviewed many of their physicians, as well as some other physicians not in their group, one-to-one, face-to-face, in person. And did you notice I was intentional to not mention the last year and a half? But anyway, I realized something in those conversations as people were sharing with me what they were using the service for, the why they're using the service. Time came up over and over and over again. But here's what I realized. Physicians are people too. We actually put this in the report that I sent back over to Jake and some others, because I think sometimes we don't think about it through the lens of, as Jake said, they're working the day shift and they're working on Epic at night in their pajama time, and they're constantly sort of in that mental state of work, whether they're working or whether they happen to have an opportunity to go to the soccer field and catch their child's game. But I made a list of things that people expressed to us along the course of those conversations. It's things like they have elderly parents. So it gets under the auspices of physicians are people too. They have elderly parents. They have parents with cancer. They have young children, sometimes multiple, special needs children. They're moms. They're single parents. They've experienced and occasionally experienced death in the family. They have working spouses. Sometimes it's two physicians married and working. I encountered that several times. They have spouses who are pregnant or they're pregnant. They have pets. They have auto trouble. Their car won't start. Their garage door won't open. They sometimes forget. And it brings to me this may come across. I hope this is okay to say on the webinar, but one physician in particular, I always like to say, well, what did you do before? You've had concierge services now for 3 or 4 years, but you didn't have it 4 years ago. And so what's different? And one mom of a young daughter looked at me and said, I think I sucked. That's all she could say. She said, my life before and my life after, I give my family more time and I give my patients more attention when I'm with them, simply because I'm able to delegate time, drain issues, personal needs that I have. I'm able to get someone else to take that load, that burden, and handle those things for me. And to me, that's powerful. A lot of times I think people feel like they shouldn't say how they're really feeling or they're really struggling. And I think it's especially true for physicians. There's a certain expectation that you be resilient and you not show weakness. But those who are willing to express themselves in that way, those are the people who realize if I had a resource, then it could totally rewrite my experience with my family or my family's experience with me. And it's going to give me more time and attention for my patients as well.
Josh, Bill's remarks really make me think of something that I think is valuable to this conversation, because if you break down the actual services the concierges are providing, one might think, these are these are simple little things. These aren't a big deal. But if we really were honest with ourselves, these are the things that consume our lives. These are the things that make us sometimes feel like we don't have control over our lives because we're not able to get everything done that we want to get done because there's things that we need to get done.
Mm.
And I think probably, at least speaking for myself, the last year and a half has just accentuated that. So much of, I think, the accelerated wellness concerns that we're seeing among our workforce since COVID has hit has been, yes, a lot about the workload, but also a lot about the feeling of this sense of loss of control. That we don't have the control over our lives that we once did. And to be able to eliminate some of those pieces that prevent us from having control over our lives, I think has an exponential impact. It's not the fact that somebody took my truck to the dealership to get an oil change. It was that I can feel more accomplished at work, or I don't have that distraction. And so the schedule I build for myself is not interrupted by having to go do that. Or I get home a half an hour earlier to see my kids before they go to bed. I mean, whatever is important to us, we want to have control over it. And that this service, among other things, helps to restore some of that sense of control. And so I think there's at the risk of getting a little too deep here, there's a psychological aspect to it that I think is very empowering. And it provides people, a much greater sense of control over their lives, both at work and at home.
Jake, you triggered Josh. Sorry if you're getting ready to say something. I think I cut you off last time as well. You reminded me of sort of the stump speech I've been sort of dwelling on for the last few weeks, and it's this idea. I call it a hypothesis, and it's relative to burnout. And it's this: burnout most often occurs when work and non-work personal commitments come into unavoidable conflict. I have to choose, and work typically wins. My work has to be done. That's where pajama time comes from. Is people are home, but they still got work to do, and they got to get it done. It's an obligation. It's a regulation. It's an expectation. And it also drives my paycheck. And so I have to get that work done. And so there's a give and take there. And the more my family loses, the more I feel like I'm conceding to something that doesn't completely fulfill what my values are. It is that conflict that drives this. We've been talking a lot about it. It really is a conflict of the soul. And that is, I think, a key component of burnout or of being unwell, is when I feel like I've compromised so much that I've lost my identity and I've lost my ability to maintain a certain identity, level of trust, level of time with my family. So just wanted to add that in there.
That was well said, Bill. So thank you for sharing that. I think there's some folks on the call that may think, well, this type of service might be something we never embrace. I mean, that may be true, or maybe we wouldn't be able to do it for whatever geographical reason, cultural. Hopefully not cultural reason. I think it's a positive cultural impact, regardless of who you are. But if we're giving back time is the key theme here, and that's the recurring theme, really. If you could share, I'm curious, what's the most frequent service that's used? It doesn't have to be among the physicians, just more kind of broadly. Is it dry cleaning? Is it getting an oil change? I mean, if you think about the utilization of best upon request, what's the number one at the top of the list that employees across the demographic base are accessing?
It varies a little bit by demographic, but auto services are always in the top three. And again, that's a big one that can be unplanned or planned. So auto, Shopping is often one, and that could be gift shopping, that could be grocery shopping, that could be internet shopping to support someone. So shopping, auto, shipping is another big one. We live in the Amazon age, and people get stuff at their home and they go, oh, that's not what I wanted, or it doesn't fit, or it's the wrong color. Well, they don't really have time to send it back. And I've had lots of our customers tell me, I throw them in the car, and when I when I run into the concierge, I hand off 2 or 3 or 4 things at a time to be sent back. And so we're doing shipping because people simply don't have time. Many physicians that I've interviewed, they told me I do almost all of my shopping online, and the concierge does all of my returns. So yeah, that would be the top three for most cases.
Great.
But other is a big category for us because, like Jake said, he used it extensively for a family member's wedding, and so people are using it. And I mean, it can be a significant sort of game changer if you've made a commitment and you're unable to keep that commitment, and then you've got a resource to step in and help. Something Jake said a second ago drove a metaphor, a physician, and it was a St. E physician who said this to me. She said, your service is, it really is removing a pebble in my shoe often. And she said, so if you think of walking around with a pebble in your shoe, it doesn't matter how big it is, the smaller, the worse probably, but it's annoying. It's an irritant, and it keeps you from walking at full speed. If it's in the wrong spot, or if it's of the right size, it can make you walk with a limp. And ultimately, it can cause problems beyond hurting your foot in the moment. It can even develop into an infection if the irritant isn't removed. And so when she said that, I was like, wow, that's a really great illustration. And I think that's what's happening. People are, they have things in their lives that they can't seem to master or conquer based on time. And so they find the resource of a concierge in this case, and it solves for the irritant. They get back in stride. We're enabling them to go at full speed, both with their family, with their patients.
Josh, I feel compelled to clarify. I didn't use the concierge to have someone plan the wedding.
Sorry about that.
I didn't want the audience to say, oh, look at him take advantage of it. No, but one of our physicians did that for real. And it was an amazing bend over backwards moment.
I was going to sidebar with you after the call. I was curious when Bill said that.
Josh, there's I sent you a slide. If you wouldn't mind to put it up, it's from an article done by Medscape. It's called "Death by 1,000 Cuts," and it's their 2021 physician burnout and suicide report. And I summarized. I did some clipping from the article, so you're going to see a chart here in a second, hopefully, that has some bars on it. That's directly from the article, and then you're going to see some little hourglasses and another little image in the corner there, and I put those on. But physicians were asked in this report or in a survey, how are you keeping up your happiness and mental health? And their answers were 66% were doing activities and hobbies that I enjoy. That's a time play, and so I put the hourglass beside it. Exercising requires time. Spending time with family and friends, it's in the phrase. Getting enough sleep, eating healthy, going to therapy. These are all legitimate things that physicians, nurses, healthcare providers in general need to be considering. And all of them, with the exception of other or none of the above, are time constrained. And so it truly is a big work life is truly a big time dependent balancing act. And when you have a resource, and I think St. Elizabeth, they're an amazing partner. When I love going and visiting with their physicians or visiting with Jake and Dr. Bob Pritchard, the CEO there, you can tell they have an amazing culture. And I'm certain their patients feel the same way because you can feel it. You experience it when you speak to folks there. But it doesn't matter the organization. Every organization has to consider their culture and what are they doing. But I think St. E is doing beyond concierge services, to your point a minute ago, Josh. St. E is doing several things really, really well. And it just so happens that concierge services is a key part of that because it is an impact on time. But again, I don't want us to take credit for all the things that they're doing. They have an amazing culture. And I should say that it takes a healthy culture and an emphasis on culture for us to be a good fit or a good partner for an organization. And so the chemistry is there as well.
Well, Bill, I appreciate that. And Josh, as I anticipate us moving into inviting questions, there is one final thing I wanted to make, and it was kind of around culture, because I alluded to the board retreat that we had back in 2017 that focused so heavily on culture. And what I didn't mention, although those that are watching may have inferred this, is that so many of the initiatives that came out of that retreat were about what the organization can do for the providers and associates. And we followed through on a lot of that. What are some ways in which the caring for each other, part of our mantra, came from the organization?
Mm.
This last July, we held another board retreat, as we do every year, but having been 4 years, we wanted this one to again culture rather than about regular strategic planning. And part of it was we were curious to see where we were compared to what we were working towards following the 2017 retreat. But part of it also was to purposely see what organically came of the conversation. And what's interesting is themes such as connectivity, collaboration, communication, all came out of this most recent retreat, with the context around them being, how do the physicians and the providers and the associates have more control or more ownership over their experience in the workplace, which we felt very, very good about. We felt that I used the word empowerment or regaining some control earlier, and maybe I'm hearing what I want to hear from the retreat, but what I'm hearing is that our people are feeling more empowered and more engaged to take that control over their own well-being. And that some of the services and initiatives we put in place have given them that opportunity, so that moving forward, it's not just about what can the organization do for my well-being, it's what can I do for myself, and that those resources are in place to do it, and the environment is in place to do it, to impact greater change moving forward. So that was a very exciting moment, I think, in our organizational development to have that conversation. And I'm looking forward to it moving forward as well.
Josh, in those interviews that I did with St. Elizabeth physicians as well as some other groups, and I remember this vividly at St. Elizabeth, one of the questions that we asked, it was a conversation mainly, but we had a few questions that we wanted to specifically ask. And one of the questions that I love to ask is, if I could be a messenger for you, what one thing, whether it's got anything to do with concierge services or not, what one thing would you like me to share with your organization if that were a possibility? And over and over again, but one person in particular, the way that they said it, she said, just tell them they're listening. Just tell them they're listening. And that's very powerful. And I think that speaks to their strategic process. I think that speaks to really trying to get to the core of what's driving their culture. And one other thing I wanted to say, unrelated to that, is you talked earlier about organizations that that may not be able to afford this kind of service. And what I would say is, it's not an expense, it's an investment. And so as I was interviewing physicians, I heard things. Of course, I can imagine that if we're helping their culture, we're helping the patient experience. If we're helping culture, we're helping their throughput. If we're helping culture, we're helping with the success of the system, because we're sort of like fresh oil in the engine. We're helping the engine run well. But beyond that, from an ROI standpoint, and I wasn't fishing for this kind of information, it just came out. I had physicians tell me, look, I get recruited all the time. I'm going nowhere because of the many ways that St. Elizabeth listens, takes care of me, and the concierge service is no small part of that. Another physician said, I was part-time, 2-3 days a week. My husband's a physician. I was able to go full-time with this service. There may be those listening and going, that's not possible. It absolutely is possible. And again, I wasn't asking, but when you are increasing the number of appointments that a physician can take because you've taken things off of their personal to-do list, that's a significant financial ROI impact. Full-time to part-time, reducing turnover of your organization. Dr. Pritchard, Jake's partner in crime at St. Elizabeth, said to us recently, he said, if I save one physician, this thing is paid for itself. And so it is absolutely an investment. In any size organization, there's an ROI. Retention, recruitment, less cancellations. It has a significant impact.
Well, I see the applicability not only to the employed physician groups, but the benefit to medical staff in general, employed or not. Nursing, obviously headline after headline about the nursing shortage right now. I mean, to be able to offer a benefit like this to nurses or potential nurses that join the organization, I mean, it's huge. It's giving back time, like you said, that recurring theme. So, we've heard how it's implemented at St. E's, but I see different flavors of this and how it could be implemented at other healthcare organizations. The question came through, what is your service area, Bill? I mean, I know you're based in Cincinnati Metro. We've got participants on the call from across the Midwest, Great Lakes area. Sure.
So we kind of a picture of our footprint. We're heavy involved in the Midwest, and we're headquartered here, of course, but we have a very large footprint in the Michigan area. We have a span from Connecticut to California. And so we're not densely populated in some of the less densely populated states, but we will go anywhere to help an organization with their culture.
Is there how do you mentioned employers as few as 50 employees up to 20,000 employees, or no limit, I guess, or no ceiling.
That's correct.
So to speak. But what is required as far as the characteristics of an employer for them to be a good fit for you?
Yeah, I mean, as I said earlier, what makes St. Elizabeth a great partner is because they are committed to their culture first. They didn't say, let's get best upon request, it'll transform our culture. So we became a key component for them, a key initiative for them. And I think first and foremost, a commitment to culture. Second, a problem to solve. If you are looking to reduce turnover, if you're looking to increase your ability to retain or recruit, that is a really key element of what we impact. St. Elizabeth, and maybe Jake could speak to this, but they're tracking engagement and their engagement scores. Dr. Pritchard recently said they hit the trifecta last year, from patient experience all the way to physician engagement. And I forget what the middle one was, but anyway, I think organizations who care about how their employees feel about their work and who care about something we say, it's almost become cliche in our organization. One of our clients said this: we want our employees to win at work and win at home. And so if an organization does really care about what happens at home and the impact that they can have in that space because of how they care for their people at work, then that would make a great partner for us.
So maybe getting a little more granular on size-wise. So you've got a 50 employee gastro practice, 10 docs. I mean, does that fit your profile? You would work with that group as well?
I'll try to work with anyone. It depends on what the challenge is and what they're looking to solve for. And again, we can scale our service based on, or scope our service based on, the size of the organization. So in an ideal case, for us to get granular, in an ideal case, there would be at least one concierge serving the population. In some circumstances and smaller organizations, we actually have a part-time person serving in that organization. At St. Elizabeth, we have multiple concierges serving their physicians because there's 700 of them across the edge of 3 states, and so they're quite spread out, and our folks are out there hustling every day to make it to all the different locations. I think Jake said 75 locations. So it all depends on what the organization looks like and how it's dispersed across a community. Is it in one location or multiple locations? And so all those things matter in terms of scoping. But yeah, we will do our very best to work with anyone, because again, for us, it's mission work. We're trying to help solve for a healthcare organization's biggest challenges.
Great. All right. Well, I think we'll wrap it up there. Thank you, Bill, and thank you, Jake, for your time today, and thank you to our audience as well for joining. It really, really great turnout from healthcare organizations of all sizes. So, as a follow-up, we will just send contact information to participants, or to the attendees today for the participants on the call. And if you receive this invitation from a USI, one of my USI counterparts or myself, please feel free to reach out to us directly if you wanted to learn more about Best Upon Request, or if you had questions for Jake, or whatever the case may be. So everyone, have a great afternoon, and thanks again for joining.
Thanks, Josh. Thanks, Jake.
Thanks, Josh. Take care.